Let's talk about something half the world experiences, the menstrual cycle. Whether you're a student, a patient, or just curious, this video will break it down simply. The menstrual cycle is a monthly series of hormonal changes that prepare the female body for pregnancy. It's typically around 28 days, but anywhere between 21 and 35 days is normal. The follicular phase starts on day 1 of your period. During this time, FSH, follicle-stimulating hormone, rises, encouraging follicles in the ovary to mature. One follicle becomes dominant. Estrogen rises, stimulating the growth of the endometrial lining, preparing it for a potential pregnancy. Around day 14, there's a surge in luteinizing hormone, LH, which triggers ovulation. The mature egg is released from the ovary. This is the fertile window, the best time to get pregnant. After ovulation, the follicle becomes the corpus luteum, which secretes progesterone. This hormone maintains the thick uterine lining in case the egg is fertilized. If fertilization doesn't happen, the corpus luteum breaks down, hormone levels drop, and the lining sheds. This is your period, starting the cycle over. Now, let's look at contraceptive medications, how they work, and their side effects. 1. Combined oral contraceptive pills, COCPS. Examples are ethinyl estradiol plus levonorgestrel, ethinyl estradiol plus drospirenone, ethinyl estradiol plus norethistérone. These contain estrogen and progestin. They work by inhibiting FSH and LH, no ovulation, thickening cervical mucus, sperm can't swim through, thinning the uterine lining, less friendly for implantation. Side effects include nausea, breast tenderness, increased risk of blood clots, especially in smokers over 35. 2. Progestin-only pills, mini pills. Examples are norethindrone, desogestrel. Mini pills work mainly by thickening cervical mucus and sometimes preventing ovulation. They're a great option for breastfeeding women or those who can't take estrogen. Side effects? Irregular periods, breakthrough bleeding. 3. Long-acting reversible contraceptives, LARCs.
A. Implants. Example, etanogestrel implant. B. Hormonal intrauterine device. Examples, levonorgestrel intrauterine device.
IUDs and implants release steady progestin, stopping ovulation and altering the uterine environment. They're highly effective and last for years. Side effects: cramping after insertion. Irregular bleeding often settles over time. 4. Emergency contraception. Examples are levonorgestrel, ulipristal acetate, copper IUD, most effective if inserted within 5 days. Pills like levonorgestrel delay ovulation and are most effective within 72 hours after unprotected sex. Side effects: nausea. Delayed period. To recap, the menstrual cycle has 3 phases. Hormones control the release of the egg and preparation of the uterus. Contraceptives work by blocking ovulation, thickening mucus, or altering the lining. Understanding your cycle helps you make informed choices, whether it's for health, fertility, or contraception. Like, share, and subscribe for more animated medical breakdowns.